coming up on the Doctors Hospital podcast.
What we have tried to achieve, and I think we are there now, is that each one of our ambulances at any given time is an advanced life support ambulance. And why we're building so many paramedics is that at any given time, you want one of these paramedics on your ambulance tending to you.
Right.
On Saturday, February 22nd, 2025 at 7 p.m., the Bahamar Convention Center will set the stage for an unforgettable celebration of 25 years of giving back and supporting healthcare education in the Bahamas. Experience a night of excitement with exquisite fine dining, captivating live entertainment, and an inspiring atmosphere as we come together to celebrate and shape a brighter, healthier future. Tickets are available now. Reserve your spot today by emailing dhfoundation@doctorshosp.com or calling 242-302-4640. Sponsorship opportunities are also available to show your support for this important cause. The Doctors Hospital Maya Rassin Foundation, 25 years of transforming healthcare and building a legacy. Don't miss this special celebration.
Hi everyone, my name is Eddie Russell. I am the Learning and Development Specialist within the Doctors Hospital Health System in our GLOW department, which is the hospital's wellness solution. And welcome to the Doctors Hospital podcast, where we connect public health issues to what we do in the Doctors Hospital system. Today we have a very special guest. We have Dr. William Seymour, who's the emergency medicine consultant and lead for pre-hospital and rapid response services within our system. These are the people who are on the ground. This is the team that's going to pick you up and possibly fly you out. So, Dr. Seymour, welcome to the Doctors Hospital podcast.
Thanks so much, Eddie. Thanks so much.
You're welcome. Thank you so much for being here. So I'm going to jump right into it because everything starts with a history, right? So can you start by sharing an overview of the Doctors Hospital emergency transport services and how it's evolved since its inception in 1994?
In 1994, wow.
It's been that long.
It has been. I think for the history of the Doctors Hospital ambulance service, more or less, to simplify it, it came out of Medevac. There was a pioneering advanced life support ground ambulance. It was there were a number of physicians involved. There was Dr. Ronnie Knowles, Bart McCartney, Dr. Frank Walking, Charles Diggins, and Dr. Cornville Brown. Dr. Diggins evolved the Doctors Hospital emergency transport services out of this, and they had an advanced life support ground ambulance that has now evolved from one ambulance to having 6 ambulances with more on the way. We also have 8 paramedics, 9 in training. So by the end of this year, we're looking to have about 17 paramedics.
Yes, that sounds like a fleet.
It's a whole fleet. It's an army.
An army of paramedics and EMT professionals.
We're ready to fight. We're ready to tackle any and all illnesses, pre-hospital in that space. We're ready for it. We're geared up.
I think when we think about emergency medicine and the people who conduct these services, when we hear EMT and paramedic, I don't know about you, but for me, well, obviously not for you, but for me and the wider public, what is the difference between the two?
Well, lots of persons just see these persons as this team. They see them as ambulance drivers. It's so much more complicated.
Quite degrading, I would imagine.
They do not like to be called that. Let me say that. If you ever meet one, please do not say, "Hey, you're an ambulance driver." They'd be very upset because so much more goes into what it is that they do and what they have done or how they have prepared to get to this place.
Right.
EMTs, well, let's for basics, all of them go and everybody starts off as an EMT, and that's those I'm unaware that stands for emergency medical technician. So they do a good amount of hours, I think a few months of training, and they're certified in recognizing basic life support, first aid measures. How do you operate in that pre-hospital space to essentially preserve life, limb, and organ? After they do that, they can specialize, so to speak, and they become paramedics. Now, paramedics, they would have studied for 2 years.
Okay.
And after they have been paramedics, they can subspecialize into different things. And you have things like a critical care paramedic. So that kind of talks about it. If we want to talk about what it is that they do, the research has shown that patients have better survival if in the pre-hospital space we, instead of doing a scoop and run, we stay and play.
Mm.
The paramedic is essential in this space. What that paramedic does now is they're able to go a bit higher than what it is that is basic.
Mm-hmm.
They're able to read your heart rhythm. They're able to apply any number of specialized splints
Mm-hmm.
or give special medications, things that can enhance your chances of survival. They can make your experience a whole lot more pleasant, and ultimately your odds of doing well increase when you have these persons tending to you in that pre-hospital space.
So would you, and just to simplify, because I mean that was quite simple, but would you say it's kind of like an EMT would assess and manage, and then a paramedic would go a little bit step further to maintain and stabilize until you get to the hospital?
Absolutely. They start in EMTs and paramedics. They just dive a tiny bit deeper and get into the details. And yeah, that's what they do.
And I know that we have a certification, an EMT certification. Do we have that at Doctor's Hospital?
We do. So each EMT must complete EMT school. And
Right.
we do have an EMT school here at Doctor's Hospital.
And the Institute of Learning, by the way.
Institute of Learning, IOL.
Shameless plug.
And they do really, really well there. They have successfully trained numerous EMTs. Once you graduate that school, you do a bit of preparation and you take an exam called the NREMT. That's the National Registry of Emergency Medical Technician exam.
Mm-hmm.
When they take that exam, that's the official licensing exam that qualifies them to be EMTs.
Okay. And so they do that, and that's done locally. But the paramedic course, you have to definitely go off for that.
For now, we're looking at bringing it back here to Doctor's Hospital. That's one of the things one of the future projects that we have.
All right. I love that. How many EMTs and paramedics do we have? I think you touched on it earlier, but just for the safety of the public, because I imagine you have this team and you're basically servicing an entire island of for like any sort of health issue. How many do we have?
We have
in our system.
In our system, we have more than 40 EMTs, paramedics. We have 8 currently employed with us. We have 9 in training.
Okay.
And yeah, by the end of the year, we should have about 17 paramedics in total.
Yeah, right. Doctor's Hospital do it? No.
They're doing it. They're doing
it. How does your service handle emergency dispatch requests? Because I know all you pick up the phone, 911. How does that actually work?
So if you pick up the phone and you dial 911, it goes into a central dispatch. That's not Doctor's Hospital service as yet, although we are working to get into that space. But that goes into a central dispatch, and they then can either dispatch one of their ambulances, or they can call us to see if we're available. If they, for whatsoever reason, are overwhelmed, and see if we can offer services. The way that you can contact the Doctor's Hospital ambulance directly is by calling 302-4747. That plugs you into our dispatch. And there we have persons 24 hours who, at any time, they're able to listen to your request. And based on what it is that you say, they know what to do next.
Okay.
If you say that, and I won't tell you all of the code words to use, but if you, in essence, give them the idea that you are more stable than somebody else,
Hmm.
we prioritize who it is that we go to see first.
Okay.
So that it kind of works there. It's not that we're not going to come to you, absolutely, but if somebody is
I
on
mean,
the brink of dying,
yeah.
we're going to run to them first before we run to you because you stubbed your toe.
I mean, and it kind of makes sense.
It kind of
Kinda
makes sense. You'd be surprised at what it is that persons get upset with, and lots of times they would call and they would say, "This is Doctor's Hospital. I expect an ambulance here within seconds. Please employ the jets and get to me before I hang up the phone." And we try. We honestly, our aim is to please and give you the best care that we can. Sometimes. And one of the ways you can kind of excuse us for if we do take a bit of time is because somebody else was about to die and we were trying our best to
be on their way out, and we're trying to assist them.
So if we don't get to you right away, it's probably a good indication that you're not doing so bad, but we will get to you soon.
We
As
coming.
soon as we're coming.
We're coming.
Yeah.
Could you walk us through that entire process, by the way?
Yeah.
And this whole pre-hospital process. Because I understand that it could be people. I always think that awareness and knowledge always kind of soothes patients. When I used to work on the floor, I know that they look at everyone who's attending to them as the subject matter experts, and so they might be a little bit, shy. They might be a little bit unable to voice their concerns because they don't know what's happening.
Right.
Walk us through that pre-hospital process
Okay.
after you would have received a dispatch request, please.
Call. All right, no problem. Call comes in. They based on what it is that you say, and also where it is that you're located, our dispatcher patches into our fleet of ambulances. Now, we have ambulances situated at different points in the island.
Okay.
We can have some in the east, some in the west. And based on who is it that's able to get to you fastest, the dispatcher would give these persons a call. After they receive their call, crew gets suited and booted, and they head to you. Now, once they get to you, they stay in play for a bit based on what it is that's going on in the situation. Once they have made their assessment, their initial treatments, they package you up and they bring you to either the hospital or one of our satellite locations based on what your complaint is and where it is that you're located. And if you are to, I know some persons with a bit more insight into this would know that there are different levels of ambulances where some do just basic life support, others do advanced life support. What Doctor's Hospital, under the guidance of the president, has what we have tried to achieve, and I think we are there now, is that each one of our ambulances at any given time is an advanced life support ambulance. And why we're building so many paramedics is that at any given time, you want one of these paramedics on your ambulance tending to you.
Right.
And so the more of them we have, the more able we are to have one of them getting to you in that pre-hospital space.
And the better our service.
Yes, better our services.
And patient outcomes.
Yeah.
Right? We're going to take a short commercial break, and we're sitting in studio with Dr. William Seymour, the emergency medicine consultant and lead for pre-hospital and rapid response services. We'll be back in just a minute.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctors Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Welcome back to the Doctors Hospital podcast. We are sitting with Dr. William Seymour, emergency medicine consultant and lead for pre-hospital and rapid response services. And we're talking about emergency transport services within the Doctors Hospital healthcare system. I know that when we think about being picked up or packaged, as you would have said, how do we ensure or the continuity of care during the transport? And I think I want to say that a paramedic would, that's where that whole that's where your skills come through.
Yeah,
right?
yeah, it does. I think what you might be alluding to would be the introduction of our air ambulance service that's about to come on board. How is it that we would continue care from the air ambulance into the ground ambulance,
Correct.
and back into our healthcare facilities? When things are in one system, they work better.
Right.
So if we have the patient information received, let's say, for example, you are at one of our EAGLE locations. EAGLE stands for Eleuthera, Abaco, Grand Bahama, Long Island, and Exuma. Let's say you are at one of our facilities there, and you, for whatsoever reason, require a higher level of care. You have to come to Nassau for whatever, a higher level of care.
Right.
We have your information in place. After determining that you are a candidate to fly to Nassau, we send the team for you. We have all of your information. We know what it is that's going on with you. We don't have to call outside. We don't have to see or we know who is available. We know what staffing we have. We have all of that information and so those tiny blips or drops in
that kind of impede the service, the rapid nature of the service.
And that speeds it. We get away with all of those blips and those drops. We do away with those blips and those drops. We're able to get to you. And then once that air ambulance transports you from one of those locations back to, when you come back to Nassau, the ambulance service, the pre-hospital team, paramedics, EMTs, they're able to get to you. The handover is smoother because we're operating in the same electronic system.
Okay.
We're speaking the same lingo. We know what is happening, what have happened already. We can track your progress, and so it's a whole lot smoother. Patients, it has been shown that patients do better in this scenario.
Yeah, I love that. I love that Doctors Hospital is stretching itself out so widely, but also it centralizes to this one location, and it's just easier. It's just easier to stop and shop at one place.
Yeah, it is.
Is it possible to be too ill to fly? Would you say?
Oh yeah, absolutely.
And what would that kind of look like?
So, physics laws and things behave differently when you're in air. It's not as if
food tastes different.
Food.
It does.
Yeah. Things get a bit different when you're in the air. For example, if you have a pop lung while you're on the ground, that may be stable, but once you get up into the air, the pressure is not as intense, and so that air starts to expand, and you can do a bit worse. If you have low blood counts, you require a higher amount of oxygen when you're up in the air.
Right.
So with low blood counts, you may do worse because now your oxygen levels that high up in the air may start to get a bit lower. So based on those laws of physics, based on and then too, when you're in the air, you don't have the luxury of backup. It's just you
until you land.
Until you land, there's just you. There is the transport kit that you've carried. There is the team member that you have, and you got to figure it out with what it is that you have in the air. So in a situation like that, sometimes it's a bit hard if persons are very, very, very ill. There is only so much that you're able to provide, and especially if you have like a long flight.
Right. Yeah. So once you with the air ambulance, there is no calling ambulance.
This is it.
This is it.
We're in the air. You could pray for the angels. Perhaps they may peep in the window and be able to offer some of their blessings, but that's about it.
It's the team and prayers.
That's it. the team and those prayers.
What motivated doctors to launch their ambulance service, and then how does it complement the existing ETC services that we have currently running right now?
It was the vision of the president. Here ends the scripture reading.
Go with God.
Go. And I think what it is, because we have so many of the we're getting so many satellite locations now.
Yes,
these eagle locations. It only makes sense if,
Truthfully.
like we said, if everything sits in one system, for him to be able to connect all of the different systems with an air ambulance.
I love this complete, comprehensive medical service that the hospital is providing for the country.
They even changed the name, if you look at it. It was just Doctors Hospital. Nope, not anymore. It is now Doctors Hospital Health System.
Yes. The president was very, he was very poignant in making sure you understand that it's a health system.
This is a health
And when you
system.
think about it, a system has many different parts and many different components. And that's what we're trying to provide to the public. As we wrap up and we look to the future, how does Doctors Hospital plan to continue advancing emergency transport service to improve the Bahamas and beyond?
If we could see a perfect world, if we could see a perfect healthcare system, we would have an ambulance. We would have a satellite location in every island in the Bahamas.
Mhm.
Persons would be covered across the entire Commonwealth.
Right.
There would be no delay in care. We
Yep.
would have a functional air ambulance service that gets persons to and from in the shortest amount of time possible. We have more facilities that are about to open.
Mhm.
There's a large facility that we're about to go for. We're going full speed into up in Grand Bahama.
Mm.
There is a full-on rehab wellness living center that we're about to open up in East Bay Street.
Yes.
So
yes. Very
a lot-
exciting.
It's exciting. I've been to the facility. It gives zen,
Yeah.
and there's
It's a little
healing-
slice of heaven in the
heaven.
East.
It's beautiful. It has a garden. There's a pool. It's tranquil. So that's in the facility space. We're offering lots more of those. We're growing our pre-hospital space daily. We're training our staff, and we're doing everything we can to give you like the slogan says, the best care now.
Yes.
So, yep, we're looking forward for excellence. We're going to give you everything that we can.
Yes, because that's the Doctors Hospital way. Up and away, and we're talking about and have been speaking about advancements in emergency medicine at Doctors Hospital. Dr. William Seymour, the emergency medicine consultant and lead for pre-hospital and rapid response services. Thank you so much for being here with us.
No problem. This was good. Thanks so much for having me, Eddie.
Yeah, it was great. I enjoyed the conversation and the laughs.
Yeah.
So on behalf of myself and my producer, Gally, thank you so much for listening to the Doctors Hospital podcast. Stay tuned as we bring you more episodes throughout the year as we continue to provide the best care now. Take care, everyone.
Doctors Hospital Specialist Clinic is where trusted and best care meets consistency and dedication. Let our expert specialists take you on a healthcare journey where warmth, compassion, and your well-being come first. From diagnosis to prescription, we are with you every step of the way, ensuring your peace of mind. Visit us today at Centerville Medical Center, Collins Avenue and 6th Terrace, and discover quality, compassionate healthcare at Doctors Hospital Specialist Clinic.